It's now my distinct pleasure to introduce the Governor of the State of California and to thank him for his vision and personal commitment to this major statewide initiative. Governor.
Well, thank you very much, Dr. Stober, for your passion about this subject and for your great work here for our university system. Thank you very much. Eric Brown, thank you for being here today, who is, of course, the Executive Director of California's Telehealth Network, and Terry Takai, our CIO, and the genius of really upgrading our IT system in California. And then Anish Chopra from the United States Chief Technology Officer. We want to thank you for being here today and traveling all the way out here and being such a great partner in this whole project and contributing so much money to this. But today I'm very happy to be here because we are celebrating the future of medicine, and also known as telemedicine. I think it's great to do that right here from California because we, of course, are #1 and show the world in so many areas and how to do it. I think that this subject of telemedicine falls into two categories that I'm very passionate about. One is infrastructure, and then the other one is healthcare reform. But not everyone is that fortunate, and through technology, you should be able to get help anywhere at any given time, especially in an emergency when lives are hanging in the balance. So I think in the most remote areas in California, we should be able to do that. And now, because of the broadband, we can. We included $200 million in our infrastructure package. As you know, since I've become governor, we have gotten the legislature and also the people to approve $60 billion in infrastructure in the state of California to invest in infrastructure. And this $200 million was, I think, money wisely spent or wisely invested, I should say, in a strategic growth plan. And California would train the next generation of doctors to practice medicine using the latest and high technology. In fact, UC Davis, I should say, is now building a 52,000 square foot facility, an office building where they would just do that. We are also interested in creating, of course, secure infrastructure for electronic medical records and prescriptions. A lot of people are not aware of that, but there are 1,000 people a year dying in California of just someone misreading a prescription or not having the total medical records and so on. So this is inexcusable. We are changing that and reducing errors and saving money at the same time. And of course, we have worked with the Federal Communications Commission and other partners in order to get this done. And again, I want to say thank you to the federal government for being such great partners in that. I think this is going to be really terrific because when you think about that, this is one of the first two that is being built, but there is 900 of them coming all over the state of California. I think that telemedicine is going to be the future of medicine, and I think, like I said earlier, this is also because it deals with healthcare reform. Healthcare reform, during the whole debate, the debate we had here in California and also on the national level was all about how do we provide health care for everybody and how to make it affordable and how do we make sure that no one gets turned away and that everyone has the chance. Well, with telemedicine, everyone will have the chance to get equal care. That is, UC Davis has done 25,000 teleconsultations or video consultations on every subject of pediatrics and dermatology, infectious diseases, cardiology, or whatever area it is. Now we will be able to do the same thing all over the United States and all over the world, hopefully down the line. Every day in California we will be improving lives, and because of that we will be saving lives. So again, California is showing the way. Thank you very much, and thank you for all of your great work. Thank you.
I'd like to introduce now Dr. Tom Nesbitt, Associate Vice Chancellor for Strategic Technologies and Alliances for the UC Davis healthcare system. Tom has shown incredible leadership in designing the CTN, nurturing it, and really helped get it off the ground. And I'm really proud to introduce Tom and turn this program over to him.
Well, thank you very much. It's really an honor to be up here. And again, I want to thank everybody who's spoken before me. We want to now introduce you to some of the people at the first CTN sites that are going to directly benefit from the two programs that we're celebrating today. And in fact, these people are already participating in the Specialty Care Safety Net Initiative. On the screen at Oroville Hospital, you can see Dr. Maria Alino and the mother of her patient, Darla Carius, at UC Irvine Medical Center. You can see Dr. Ira Lott, as well as Dr. Gail Fernandez. And at Communicare Salud Clinic in West Sacramento, we have Dr. David Katz. And again, all these sites are participating in both the projects. I want to start with Dr. Alino in Oroville, who, because of the Specialty Care Safety Net Initiative, was able to get 2 different pediatric consults for her patient without the patient ever leaving town. One of those consults occurred at UC Irvine, and one of those consults occurred at UC Davis. Dr. Alino, do you want to tell us real briefly about that experience?
Sure, and thank you for letting us share our telemedicine experience with you. As a practicing pediatrician in a rural area, telemedicine has afforded us a great opportunity to access specialists and network with them. I feel so isolated and hopeless when I see a sick baby in the nursery or in the emergency room. But I know with telemedicine, a specialist will be there to help me assess the patient online and actually give me real-time suggestions on how to manage a child. We are also 1.5 hours away from UC Davis. So in terms of logistics for transportation, just to keep an appointment, it's very hard for families, especially indigent families, to keep an appointment. One of the telemedicine has afforded an example, the family of Anthony here, who has been serviced by telemedicine. Anthony is a 4-year-old child who at 2 years old, mom has noticed to be very hyperactive, inattentive, and impulsive. Because of the escalating problem causing Anthony to be endangering himself and other children, at 4 years old, Darla brought the child again to me. And because of Anthony's age, he's just 4 years old, and he also has problems with prematurity at 27 weeks old and developmental delay. I did not feel comfortable about taking care of Anthony. So with telemedicine, I actually was able to get Dr. Fernandez from UC Irvine, who is a psychiatrist, to help diagnose and manage Anthony. And then within 1 week, we were able also to get Dr. Chitnis from UC Davis, who is a neurologist, to help me manage Anthony. So I think this is great medical service for a rural center like me, and it was just because of telemedicine that made it worthwhile. So here's Darla, mommy of Anthony.
Hi. Basically, there's not specialists that Anthony needed around here, so this has really helped us because he wouldn't have got the care that he needed. And we still have, we still have a ways to go, but they've helped a lot. They spend a lot of time with us on the telemed, and Anthony interacts well with it, so it's been really good for us.
Well, that's great. Well, I'd like to bring up Dr. Chitnis, who you heard about, and you can just say hello to your patient's mother.
Hello, Dr. Alino. How are you, Darla?
Hi, nice to see you again.
Thank you for coming here today and expressing your thoughts. I'm very happy that we are able to help you through telemedicine clinic through UC Davis. Thank you for coming.
Thank you.
See you soon.
Continue using you.
I just want to say a quick word about one of the issues that Dr. Lott spoke about, and that's the quality of the video. Now, this video quality is important in every kind of consultation. In neurology, he talked about why it's important. but it's particularly important in an emergency when you're providing emergency care. And I'm going to show you a video that just happened to occur a few days ago, actually, that we were able to capture with one of these emergencies that happened in the north part of the state. It is a little bit of a raw video because we captured it just recently, but this is a child who was involved in a motor vehicle accident. We actually have the film of the paramedics at the site. They bring the child to Mercy Medical Center in Reading and received consultation from one of the doctors in the audience, Dr. Jim Marson, on medications. They reviewed the CT scan together, and also you'll see how easy it was to do a follow-up visit for Dr. Marson on that case. So why don't we roll the video?
On August 3rd, approximately 5:30 in the afternoon, CHP officers were dispatched to a solo vehicle rollover. All 4 parties in the crash were transported to Mercy Medical Center.
I'm sorry, Jim, what kind of doses you use that?
0.5 per kilo BID. If you're coming up on 12 hours, it might be a suggestion to add a little glucose in that IV fluid.
Moving all 4 extremities.
You can see he's panning to look at the monitors. He can look at things in the room. Our doctor can control it, and you'll see very dramatically the skull fracture.
That was the pre.
Wow.
So it looks like it's lifted up really well.
Yeah, luckily there's no penetration of the dura. That's great. I think that given what happened and seeing the injury on that cat's skin, it's looking like everything has worked out very, very well.
This is his follow-up. He just goes down the list.
Can you say hi?
Oh, she wants her grandpa an ice cream.
She's been doing really great.
Yeah, that's super. And she's still a little bit puffy, I can see in the face, and that's going to get better too. You don't have to be a doctor to realize that was a serious injury. So.
But she's doing fantastic.
She's much better today. She got the JP drain taken out. She's been up playing, talking, active. Can you say bye?
She doesn't really like to
say bye-bye.
Bye-bye. See, he's waiting to us.
Right. Thanks. So finally, one of the ways to assure, adequate bandwidth for that high-quality video is to put in a gigantic pipe. But that would be like building 50 lanes on a freeway, and it's just not practical to do that. With the technology of the California Telehealth Network, we're going to be able to prioritize packets that make up the video stream that will allow us to have this quality of service. And for telemedicine consultations, this will be the equivalent of a diamond lane with an ambulance going down it with those packets in it that will make sure these emergency consults are seen very clearly and we don't have any degradation of the signal. So with the CTN, we're not only going to be able to provide affordable broadband to clinics and hospitals in rural and underserved areas, but we're going to be able to assure this quality of service with explicit privacy and security, leading to higher quality telemedicine throughout the state. And now I'd like to bring back to the stage Eric Brown to finish the event.
Governor, I just want to say another word of thanks for your leadership in putting things in place that made today possible. Thank you very much. And ladies and gentlemen, the California Telehealth Network is now officially launched.